If you ever dealt with that situation, a horse with a cough and it just won't quit.
Oh, yeah.
Not the really dramatic hacking kind, but that, persistent low-grade cough.
Yeah.
And you try treatments, standard stuff, and nothing seems to work.
It's incredibly frustrating for owners.
Exactly. Leaves you totally baffled.
Yeah.
Well, what if the real reason behind that nagging cough was actually hiding right there on the pasture, maybe even in an animal showing no signs itself?
An interesting thought.
Today we're going to dig into equine lungworm, specifically the condition caused by this parasitic roundworm, Dictyocaulus arnfieldi.
Right.
Our goal here, our mission for this deep dive, is really to clear up the confusion around this. We want to reveal its, frankly, surprising primary source and walk through how vets figure it out, how it's treated, and crucially, how you can prevent it.
Good plan.
And we're doing this using all the great material, the articles, the research, the notes that you, our listener, sent over for us to explore. So thank you for that.
Yes, thanks, everyone.
So get ready for what I think is the real aha moment here. Understanding the critical but often totally silent role that donkeys and mules play. Okay, let's unpack this.
Let's do it.
So, starting right at the beginning, equine lungworm. What actually is it? What's causing the problem?
Okay, so fundamentally, equine lungworm is a parasitic infection of the lungs in horses. It leads to things like bronchitis, sometimes even pneumonia.
Okay.
And the specific parasite we're talking about is Dictyocaulus arnfieldi. It's a type of roundworm. The adult worms, they're quite slender, sort of whitish gray, maybe up to 8 centimeters long. And they live in the airways, the bronchi, and the smaller bronchioles.
In the horse's lungs.
In the horse's lungs, yes.
Yeah.
But here's the really key concept: host specificity. You see, donkeys and mules, they're what we call the natural or preferred hosts for this particular worm.
Natural hosts, meaning?
Meaning the parasite is sort of designed for them. It can complete its entire life cycle inside a donkey or mule, and often the donkey shows minimal or even zero clinical signs. They can carry a pretty heavy worm burden and seem perfectly fine.
Wow, okay. So they're like silent carriers.
Exactly. They act as a reservoir for the parasite. Now, horses, they're different. We call them aberrant or incidental hosts.
Aberrant, so not the intended target.
Precisely. While horses can get infected if they ingest the larva, the parasite typically does not complete its life cycle in them. It sort of hits a dead end, evolutionarily speaking. In fact, it's estimated less than 2% of infected horses will ever develop adult worms that actually produce eggs. And that's the reason why horses rarely shed the larvae in their manure.
Which must make diagnosing it in horses really difficult.
It's extremely difficult, yes. We'll definitely get into that.
Okay, so that host difference is huge. If horses aren't usually shedding it, how does it actually spread? How does it get from, say, a donkey to a horse? What's the life cycle look like?
Right. It's what we call a direct life cycle. No intermediate hosts needed, like snails or anything.
Yeah.
It starts with the adult female worms, mainly in the airways of an infected donkey, laying eggs that already contain larva-embryonated eggs. These eggs get coughed up into the throat, the donkey swallows them, and they hatch into first-stage larvae, we call them L1s, in the donkey's gut.
Right there in the digestive tract.
Yep. Then, these L1 larvae are passed out in the donkey's feces onto the pasture.
Contaminating the grass.
Exactly. Now, once they're out on the pasture, these L1 larvae need to develop further. Over about a week, roughly, given the right conditions, they molt and become infective third-stage larvae, or L3s.
Those are the ones that cause the infection.
Those are the infective stage, yes. And they're pretty hardy. They can survive for several weeks on pasture, especially if it's damp and cool. They don't like hot, dry conditions as much.
Makes sense. So the horse just needs them.
Pretty much. Horses get infected by grazing on that contaminated pasture and swallowing these L3 larvae along with the grass.
And then what happens inside the horse?
Once ingested, the L3 larvae penetrate the horse's gut wall. From there, they migrate through the lymphatic system and the circulatory system, the bloodstream eventually making their way to the lungs.
Wow, quite a journey.
It is. And once in the lungs, they mature into adult worms. Now, this whole process from ingestion to mature worms takes about 5 to 6 weeks in donkeys. That's the pre-patent period.
Okay.
But in horses, remember, the cycle often doesn't complete properly, so the timeline can be longer or it just fizzles out before worms mature enough to lay eggs.
Got it. So that explains the biology. Now let's talk symptoms. What does this actually look like in an infected horse? What are the signs an owner might notice?
The most consistent sign, the one we see most often in horses, is that chronic, persistent cough we mentioned earlier.
The one that doesn't go away.
Exactly. And crucially, it typically doesn't respond well or at all to standard treatments like antibiotics or anti-inflammatories. That's often a big red flag for vets.
Okay, so the cough is key. Anything else?
You might see other things, yeah, like an increased respiratory rate, maybe some clear or slightly mucousy discharge from both nostrils. If a vet listens to the chest with a stethoscope, they might hear some wheezes or crackles.
Sounds like typical respiratory stuff, though.
It can be, which adds to the diagnostic challenge. In more severe or long-standing cases, especially maybe in foals or older horses, you could see some difficulty breathing. Maybe the horse just isn't thriving, perhaps losing condition, losing weight.
And you mentioned foals are particularly susceptible.
Yes, young horses can be more vulnerable. And another concern is that a lungworm infection might make a horse more susceptible to developing secondary bacterial pneumonia.
An opportunistic infection on top.
Right. And there's even some suggestions, some links in the research, that lungworm irritation could play a role in triggering or worsening conditions like recurrent airway obstruction, RAO, or what some people still call COPD or heaves.
Interesting connection. So knowing those signs, what actually puts a horse at risk? Why would one horse get it and not another?
Okay, this is where it gets really interesting, and it circles back to the hosts. The number one overwhelming risk factor is co-grazing horses with donkeys or mules.
Sharing the same pasture.
Yes, or even putting horses onto a pasture that donkeys or mules have grazed recently, say within the last few months, because those L3 larvae can survive out there.
Because the donkeys are the silent shedders.
Precisely. They're contaminating the environment, often without looking sick themselves. Other factors definitely play a role too. Wet, damp pastures favor larval survival, so grazing on boggy ground increases risk.
Right, moisture helps them.
And then, like many diseases, horses at the extremes of age, so very young foals or quite old horses, or any horse whose immune system might be compromised for some reason, they tend to be more susceptible to developing clinical signs if they do get infected.
Okay, that makes sense. So co-grazing is the big one. But diagnosing it sounds like, well, like a real challenge, especially in the horse itself if it's not shedding larvae.
Yeah.
How do vets actually confirm it? This sounds like detective work.
It really can be. You're absolutely right. Diagnosis in horses is tricky because they usually don't pass larvae in their feces, or they do it so inconsistently and in such low numbers that you're likely to miss it.
So a standard fecal test is probably not going to work.
Well, the main test used to look for larvae in feces is called the Behrman technique. It's a specific lab method that uses the larvae's own movement, their motility, to separate them out from the fecal matter so they can be seen under a microscope.
Okay, the Behrman technique.
Yes, but here's the crucial interpretation point. That Behrman test is the most reliable way to diagnose lungworm in donkeys and mules because they're the ones consistently shedding larvae if infected. They're patent carriers.
Makes sense for them.
For horses, though, it's different. If you do get a positive Behrman test from a horse, if you actually find D. arnfieldi larva, then that is diagnostic. You found the culprit.
Okay, a positive is a definite yes.
But, and this is the big but, a negative Behrman test in a horse absolutely does not rule out lungworm infection.
Because they probably weren't shedding anyway.
Yeah, exactly. So what often happens is if a vet suspects lungworm in a coughing horse that's been near donkeys, it's frequently more useful, more diagnostically fruitful to perform the Behrman test on the donkeys on the property instead.
Test the likely source.
Precisely. If the donkeys are positive, it strongly supports the suspicion in the horse, even if the horse's own test was negative.
Clever. Okay, so Behrman on the donkeys is key. What other tools do vets have for diagnosing the horse directly?
There are other things we can try, yeah. Procedures like a tracheal wash, or TTA, or a bronchoalveolar lavage, a BL, these involve collecting fluid samples directly from the horse's lower airways.
Going right to the lungs.
Right. These methods can be more sensitive for finding evidence in horses. Sometimes you might actually see larvae or eggs in the fluid, especially if it's spun down in a centrifuge. More commonly, though, when they analyze the cells in that fluid, the cytology often shows a really high number of eosinophils.
Eosinophils.
They're a type of white blood cell. High numbers in airway fluid are highly suggestive of either a parasitic lung problem or maybe a severe allergic reaction. So it points strongly towards something like lungworm.
Okay, that's a strong clue.
Sometimes an endoscopy putting a small camera down the horse's trachea might just show increased mucus, maybe some inflammation. Very, very rarely, you might actually glimpse an adult worm, but that's uncommon.
Wow, that would be definitive.
It would. Blood work, like a standard CBC, might show increased eosinophils in the bloodstream too, what we call peripheral eosinophilia, but that's not very specific. Lots of things can cause that. And x-rays of the chest, thoracic radiographs, they're useful mainly to see the extent of lung changes or maybe rule out other things like bacterial pneumonia. But the x-ray patterns aren't specific just for lungworm.
Right. And what about blood tests for antibodies, like an ELISA?
Yeah, serological tests like ELISA exist. They can tell you if a horse has been exposed to the lungworm parasite at some point by detecting antibodies, but they don't necessarily tell you if there's an active infection causing the clinical signs right now. So, exposure versus active disease.
Okay, so a combination of history, especially donkey contact clinical signs, testing the donkeys, and maybe a tracheal wash seems like the most practical route for horses.
That's generally a very good summary of the diagnostic approach, yes.
Yeah.
It often involves piecing together several clues.
Right, so once you've managed to pin down this diagnosis, what's the treatment plan? How do you get the horse better?
The good news here is that lungworm infection in horses is generally very treatable. It responds well to anthelmintic therapy dewormers.
Okay, so standard dewormers work.
Specific ones, yes. The drugs of choice are usually ivermectin, given orally, or moxidectin, also oral. Both are highly effective against the adult worms and also the migrating larval stages of D. arnfieldi.
Ivermectin and moxidectin.
Correct. Moxidectin has the advantage of persisting in the horse's system a bit longer, giving longer protection. For donkeys specifically, there's also an effective poron formulation called epidomomectin that can be used.
Coron. Interesting.
Yeah, it can be easier for some donkeys. Now, a really critical part of treatment is that you need to treat all the horses, ponies, and especially the donkeys that have been sharing pasture or been in close contact.
Treat the whole group.
Absolutely. You have to eliminate the source of the infection, which often means ensuring those donkeys are effectively dewormed, perhaps periodically, with something like ivermectin to stop them shedding larvae.
Makes total sense. What about supportive care for the coughing horse?
Yes, that's important too. While the dewormer kills the worms, you need to help the horse feel better and recover. This usually involves stall rest to reduce strain on the lungs. Anti-inflammatory drugs like NSAIDs, maybe flunixin or phenylbutazone, are often used to reduce lung inflammation and discomfort. Depending on the severity, vets might also prescribe bronchodilators to help open the airways, or mucolytics to help break up and clear mucus. And of course, if there's any suspicion of a secondary bacterial pneumonia, then antibiotics would be necessary.
All right, cover all bases.
And don't forget, good stable management. A well-ventilated, low-dust environment is key. Soaking hay to reduce dust inhalation can make a big difference for a horse with irritated airways.
Good points. So you treat the worms, manage the symptoms, treat the contacts.
Yeah.
What's the likely outcome? What's the prognosis for a horse with lungworm?
Generally, the prognosis is excellent. With appropriate deworming treatment and supportive care, most horses make a full recovery.
That's great news.
Yeah. You should expect to see those clinical signs, particularly that persistent cough, start to resolve pretty quickly, usually within about 7 to 10 days after the treatment is started.
Fantastic. Okay, so it's treatable, good prognosis, but obviously prevention is better than cure, right? How can horse owners avoid this whole scenario in the first place?
Absolutely. Prevention is always the best strategy. And thankfully, for lungworm, it's relatively straightforward, conceptually at least. The single most effective prevention method is simply to avoid co-grazing horses with donkeys or mules.
Keep them separate.
Keep them separate, break that transmission cycle at its source. Now, we know that's not always practical or possible on every farm, so if co-grazing is unavoidable,
Yes.
then the absolute critical step is to make sure that the donkeys are on a regular and effective deworming program that specifically targets lungworm, using the right drug, like ivermectin, at the right frequency.
So a strict donkey deworming schedule.
Yes, and ideally this should be combined with regular fecal testing, using that Behrman technique on the donkeys themselves to monitor whether the program is actually working and they aren't shedding larvae.
Check that the prevention is working.
Gotcha.
Got it. What about managing the pastures?
Pasture management is definitely the other key pillar of prevention. Regularly removing manure from pastures poo picking is hugely beneficial. Doing it frequently, like at least twice a week, significantly reduces the number of larvae building up on the grass.
Makes sense. Removes the source before they develop.
Exactly. Implementing pasture rotation and resting periods also helps. Larvae don't survive forever, especially in dry conditions, so resting a pasture, letting it dry out, can reduce the burden.
Okay.
Another strategy is cross-grazing with animals that can't be infected by this specific lungworm, like cattle or sheep. They essentially act as biological vacuum cleaners, ingesting the horse-donkey lungworm larvae but not getting infected, thus removing them from the pasture.
Oh, interesting idea, using other grazers to clean up.
Yep. And finally, basic biosecurity. Always quarantine any new animals, horses, or especially donkeys coming onto the property. Test and deworm them appropriately before introducing them to your resident herd and pastures. Don't import the problem.
Sound advice. Wow, this has been incredibly illuminating. It really drives home how, even though we see the cough in the horse, the whole story of equine lungworm is just so fundamentally tied to donkeys, often acting as those silent carriers.
It absolutely is. It changes your perspective on mixed species grazing, doesn't it?
It really does. You look at a donkey differently.
If we try and connect this to the bigger picture, it's a fantastic example of why understanding the entire ecological system, including animals that seem perfectly healthy, is so crucial for managing health and disease. But importantly, the outcome for the horse, once diagnosed and treated, is very positive.
Definitely a relief to know it's treatable. And it really leaves us with a fascinating question to think about, doesn't it? Something for you, the listener, to maybe ponder.
Hmm?
Where else in the world of health, animal health, maybe even human health, might these asymptomatic carriers be playing a hidden yet absolutely vital role in spreading disease or causing unexpected problems?
A very thought-provoking point to end on.